Do you want to sit up?
Pardon?
So I'm just wondering if the officials want to sit up beside you.
Hopefully not. Okay, members, as we now have a quorum, I propose that the committee go into public session. Is that agreed?
Agreed.
Thank you. The meeting has been convened to consider the Health Insurance Amendment Bill 2018. The purpose of the bill is to amend the Health Insurance Act of 1994 to specify the amount of premium to be paid from the Risk Equalisation Fund in respect of certain classes of insured persons from the 1st of April 2019, to make certain other amendments to the Act and to amend the Voluntary Health Insurance Amendment Act of 1996. I would like to welcome the Minister Finian McGrath and his officials to the meeting. And Minister, I understand you'd like to make an opening statement.
First of all, Carly, I'm delighted to be here, and I'm pleased to have this opportunity to address the House on the second stage of the Health Insurance Amendment Bill 2018. The bill, as you know, was published on the 14th of November, and its deputies will be aware it concluded its passage to the Dáil in the second stage last week. I welcome the support received in that House for the core principle of community rating, which is long established and well-supported government policy for the health insurance market. I also want to thank yourself, Chair, and also Deputy Bernard Durkan for their support on this legislation. This, as you know, this is a short and technical bill comprising 8 sections, all focus on the specific issue of health insurance. The amendments outlined in the bill will ensure the ongoing sustainability of private health insurance market and seek to the health insurance policy at an affordable price for all of our citizens, young, old or sick or healthy. The legislation is needed each year to update the amount of credits paid to insurers under the scheme and the amounts of stamp duty levied on the health insurance contracts to fund the credits. As part of the process, the independent market regulator, the Health Insurance Authority, carries out an annual evaluation of the market, focused on the claims cost that every insurer has paid over the year. Based on that analysis, the authority recommends the level of credits that should apply next year. The rates for next year recommended by the authority have been considered and accepted by the Minister for Health. This year's bill will provide for a general decrease in the credits across genders, age groups, and there will be no change in the stamp duty levy on contracts. Maintaining the stamp duty levies at existing levels should ensure that the health insurers do not increase premiums and that contracts remain at an affordable price for all of our citizens. In addition to the technical amendments, this year's bill provides for a number of amendments to the Acts governing the Health Insurance Authority and the VHI. In short, it is proposed to expand the membership of the Health Insurance Authority Board, to broaden the composition of the VHI Board and to enable VHI to sell international healthcare plans directly. And I will also outline each of these proposed changes in turn. The Health Insurance Authority was established in 2001 with the provision for 5 board members to be appointed. Since that time, the health insurance market has become more complex, with insurers adopting innovative marketing and product propositions to expand their client base and improve their risk profile. Further significant changes can be expected as the Sláinte Care programme is implemented. The role of private health insurance in our health system could change significantly, and the regulator must be able to react to this changing role and to advise the Minister for Health appropriately. For the objective and effective discharge of its functions, it is desirable that the authority includes a broad of mixed skills and experience, and expanding membership of the board will ensure that they can deliver their strategy and address any challenges they meet. The bill also contains 2 amendments to the Voluntary Health Insurance Acts, which are the governing legislation for the VHI. The first VHI-related amendment deals with the board composition, and currently the VHI board is restricted to have only 2 persons who are health service providers on the board. This amendment will remove this restriction and includes a new provision that the Minister will give due consideration to the mix of skills present on the VHI board when making appointments, thus ensuring the highest standards of governance. The second amendment to the Voluntary Health Insurance Acts deals with one specific areas of the VHI's business activities. The amendment will permit the VHI to sell international healthcare directly, not only as an agent as they are allowed to do currently, and it will remove the requirement for VHI to seek ministerial approval before selling these plans. This development is consistent with the VHI's current status as an insurer authorised by the Central Bank. VHI is competing in a highly competitive and regulated marketplace, and this amendment will remove the impediment to the VHI's ability to compete with its competitors and thereby allow VHI to avail of potentially significant business opportunities. Finally, as I've said, this bill allows us to maintain our support for the core principle of community rating, which is long established and well-supported government policy for the health insurance market, and the amendments to the legislation governing the Health Insurance Authority and the VHI are to allow these organisations to plan for future developments of this ever-changing and complex environment. I commend this bill to the House. Thank you, Carl.
Thank you very much, Minister. I now propose we go to section 1 of the bill.
Chair, can I ask for your guidance? I have some questions relevant to the bill rather than to the specific sections and subsections. When is the time to address those questions to the Minister?
Now. Now?
Yeah. Great. Minister, I'd like to ask you in terms of the risk equalisation levy. It is a regressive levy if you assume that higher income households buy more expensive healthcare and lower income households where they can afford it buy less expensive health insurance policies. The risk equalisation basically divides into two different types of policies, advanced and non-advanced policies, and it applies a flat rate to those. So it applies, correct me if I'm wrong, Minister, my understanding is it applies a levy of €444 to the advanced policies and 170 to the non-advanced policies. Now, the advanced policies range in price from about €800 to over €5,000 for a policy, whereas the non-advanced tend to be €400 to €800. And so, in percentage terms, the levy is seeking a higher percentage from people who have the cheaper policies, right? Now, the more expensive policies, when you start getting into the premium, the platinum plated, the premium policies, the difference really has nothing to do with health care in the hospital. Really, it's to do with how fancy your room is, you know, and the trappings, but very little to do with actual clinical care. And so, if my understanding of the levy is correct, essentially what we're doing is we're subsidising fancy rooms for higher income families. Now, one way we could change this levy is to apply it as a percentage of the price of a health insurance policy. And can I ask you, as part of the deliberations for the bill this year, was there any conversation around changing the levy from what I think is probably broadly accepted as a regressive measure into either a neutral measure or potentially a progressive one? Thank you.
Okay. Thank you, Deputy Stephen Donnelly, and I want to say well, first of all, that I'm stepping in today for Minister Simon Harris, as you know, is busy in the upper house. But in relation to the regressive levy on the 440 advance and the 170 non-advance on the issue of higher pay, I'm told, but I will come back to you in more detailed response, that older people tend to buy more expensive policies. That is what's going on in the market at the moment, and the levy as a percentage then would increase the cost. That is the thinking behind it. But I will come back to you with a more detailed response in relation to that particular question.
Okay, I appreciate your stepping in for the Minister, but this is committee stage on the bill. My question speaks directly to what is being proposed in the bill. So, how do we proceed?
Well, there are no amendments to the bill, so you can make comments, you can ask for the Minister's response.
Yeah.
We are strictly confined to going through this section by section, and there are no amendments. So you're quite entitled to make comments and receive a response.
But ask questions. This is committee stage.
Yeah. You can reserve the right to introduce an amendment at report stage.
It's just not very satisfactory, Chair. This is we should at the Health Committee be able to get this. I'm not asking a sort of a curveball question. This goes to the very heart of the levy. This is no reflection on the Minister. I know he's stepping in for Minister Harris, but this is hardly satisfactory. The question I'm asking goes to the heart of the legislation in front of us.
Brought it up here. You can bring it up at report stage.
Well, I can't really, though, Chair. I mean, you know how the committee stage is really the only chance we get to go back and forth.
Just the point you raised, it was considered this year by the HIA, as far as I know, but that doesn't mean that they can't look at it again. So whatever your suggestion can be examined again. And I'll give you commitment that I will go back to the Minister, Simon Harris, on this particular issue.
Okay. Look, I know it's not Minister McGrath's fault, but this is not satisfactory. Like, at committee stage, we should. The question I'm asking goes to the very core of the legislation in front of us. It's not some obscure question. So I'm not having to go with the Minister. I understand he's stepping in, and I understand Minister Harris is dealing with critical legislation. But for the record, this is not a satisfactory situation. This is a basic question on legislation before committee that should be answerable. You know. Okay. Thank you.
Okay, I propose that we now go to the bill section by section. The question.
Sorry. Can I have you go on a second question?
Yes.
Minister, one of the frustrations that some in the industry have, there is a view that the VHI is holding unusually high reserves, which means it passes the overcompensation test, which is relevant to the levy, obviously. So the belief is that they meet the criteria of keeping their profits below 4% by moving an unusually high level of those profits into reserves, thereby not having to declare them as profits. Now, personally, I think with the history of insurance companies going into liquidation here, that actually the more reserves the insurance companies have, the better. So I think that's not. I'm not suggesting that they should have low reserves. However, it's relevant to the legislation because by holding reserves which are significantly above the Solvency II levels, the rest of the industry, it has an impact on the rest of the industry because they are able to manage their profit margin down. Can you tell me if any of that was considered in the context of the bill for this year?
There's no question of whether they pass the test or not.
The overcompensation test has not been conducted, and it will be done next year by the HIA and the VHI. These were required, so that deals with that particular issue.
Well, the question I'm asking is the government's view in the context of the legislation this year as to the VHI's reserves being so high. So I think about 80% above the Solvency II requirements, so very significant, which means that they have historically met and will meet the overcompensation test. The question I'm asking is what the Cabinet's view is on this. Are they content with the, I won't call it over-reserving because reserves are good, obviously, but the very high reserves and the impact it potentially has on the insurance industry?
Yeah, can I just say that just on the frustrations, and I take your point, but the VHI are an independent commercial company, and they, as far as I'm aware, they are in the process of lowering it.
Of lowering what?
The reserves.
The reserves.
Yeah.
Okay. Thank you. The final question then just goes to the Consumer Minister, and this is somewhat tangential, but we have about 300 health insurance policies in the market. Now, I know the central bank is pushing for simplicity, and my understanding is actually the number has fallen from about 400 to about 300. But I think we can all agree that it is pretty much impossible for anyone to find the right health insurance policy for all sorts of reasons. But a lot of the reason is this massive over-complexity. I think it's bewildering. It's not relevant to the bill, Chair, but the question I'm asking is, did the Minister or the Department or indeed the Central, did any apparatus or part of the state use this legislation as leverage to engage with the industry with the view to seriously driving down the over-complexity in the industry so that consumers really understand what the best package for them and their families is?
Okay. Well, just first of all, I agree in relation to it has come down from 400 to 3 in the region of 300 policies, and the over complexity of the issue is very relevant to the debate as well. But just to say as well, Deputy, there are ongoing discussions with the insurers, but that is also up to the regulator as well.
Well,
Thank you, Minister.
Okay. Well, I mean, it is and it isn't, right? I mean, the central bank obviously is involved, but the central bank is involved based on legislation that we pass. So, you know, obviously the Minister, the Department of Health, the Cabinet has a role to play. Thank you, Chair. Thanks, Minister.
Finally, I will actually come back to Deputy Donnelly as well with more detailed responses to the individual questions that he's raised here today on behalf of Minister Simon Harris.
Thank you, Minister. So we will now go through the bill section by section. So the question is that Section 1 stand part of the bill. Agreed. Is that agreed? That Section 2 stand part of the bill. Is that agreed?
Agreed.
That Section 3 stand part of the bill. Is that agreed?
Agreed.
That Section 4 stand part of the bill. Is that agreed?
Agreed.
That Section 5 stand part of the bill. Is that agreed?
Agreed.
That Section 6 stands part of the bill. Is that agreed?
Agreed.
That Section 7 stands part of the bill. Is that agreed?
Agreed.
That Section 8 stands part of the bill. Is that agreed?
Agreed.
So that this be the title of the bill, an Act to amend the Health Insurance Act 1994 to specify the amount of premium to be paid from the Risk Equalisation Fund in respect of certain classes of insured persons from the 1st of April 2019, to make certain other amendments to that Act, to amend the Voluntary Health Insurance Amendment Act 1996 to vary the basis on which persons are appointed to be members of the Voluntary Health Insurance Board, to amend the Voluntary Health Insurance Amendment Act 1998, to enable Voluntary Health Insurance Board to act as an insurer in addition to an agent in respect of the provision of health insurance cover pursuant to an international healthcare plan, to make a consequential amendment to the Stamp Duty Consolidation Act 1999 and to provide for related matters. Is that agreed? Agreed. Thank you very much. As consideration of the bill has been completed in accordance with Standing Order 90, the following message will be sent to the Clerk of the Dáil. The Select Committee on Health has completed its considerations of the Health Insurance Amendment Bill 2018 and has made no amendments to the bill. Is that agreed? Agreed. Minister, I'd like to thank you and your officials for attending this afternoon. Sorry for the adjournment, but it was because of business in the Dáil. This committee now stands adjourned sine die.